autism and the importance of timely action. And to cover that topic with us, we have Dr. Debasis Panigrahi, consultant pediatric neurologist, Ankura Hospital, Bhubaneswar. Over to you, sir.
So, good afternoon, one and all, and I'm really thankful to Ankura team for organizing this very important webinar on autism, when to worry and when to act. So, basically, so in this webinar, mostly we will discuss about autism, what are the red flags, and when to worry. So, to start with, I will say first thing ki autism is not a disease. Mostly we'll say ki it's a condition where there is a developmental difference. And it's a neurodivergent condition where there is a developmental difference and it shows itself gradually. So it's not like that ki autism develops very suddenly or in a day. It is the symptoms are visible over a period of time. Therefore, when we say ki the symptom should be present in early development and mostly before 3 years of age. The symptom starts to begin before 3 years of age. And every child different are different, they develop at a different pace. We will say ki even normally also children develop at different pace. Some children speak early, walk earlier, some with little delay. But when we say about developmental delay, every developmental milestone, take it as whether you take it as uh, gross motor milestone like sitting, walking, whether you take it cognitive development, whether you take it speech and language development, there is always a range for that. And whenever there is a significant delay or the range is past, then we start to become worried why this is not happening. And autism is a unique condition because we say it's in the autism spectrum disorder. Spectrum means there is a wide spectrum. There's a symptom, the sign, the severity will not be same for each and every child. So it's a different. Some children are in the milder end of the spectrum with little involvement, whereas some children are at the higher end of the spectrum with lot of involvement. And one thing I want to highlight here, it's a neurodevelopmental disorder with more and more research showing there are more and more genetic basis to the condition. So we'll say parenting cannot cause autism. So many times parents say ki we didn't give child to the time to the child, that's why the autism has developed, or excessive screen exposure, that's why autism is there. So basically this can be confounding factor that can affect severity maybe, but cannot itself can be a causative factor for autism spectrum disorder. So parents should not think that due to their parenting the child has developed autism. So that's one thing is uh, I have to go back because it's a fixed camera on a desktop. So that's now it's better.
Yes, sir.
So that's the thing. So second is that key when we say key when to worry, then we say when not to worry. So what are the things that a child? So many times parents have the saying कि my child is not speaking. जितने मतलब in time when the child should start speaking, that my child is not speaking. So at every speech delay autism? No. So there are things that we don't we should not worry about autism or chances of diagnosis of autism is less when the child is talking late, but good understanding and there is a good communication by non-verbal method like gestures. So if a child is there, 2 years child, he is speaking only few words, but when you ask where is Papa, where is Mommy, he is clearly pointing, using gestures to communicate. He can point to things when this one. So the non-verbal communication part is good and understanding is good. Then it may not be autism. Many children are shy. They are when they come out they don't speak, but when at home they are very good at communication with the parent and people known to them. So this is one thing that we see that may not be autism. So autism, what happens? Many children of autism prefer routine, but it is very rigid. But some children who are non-autistic also, they also prefer routine, but they can adapt. When the routine is there, but when the child is too resistant to change or difficult to adapt to a new situation, then these things are more worrisome. Some children line toys in autism, non-autistic children also do that, but in that case, generally, they have also very imaginative play. They play with in a better way. So these are something not to worry. But then we'll see what are the early or red flag signs of autism. When the symptoms are there, the parent or somebody should be worried more. So now recently a paper has come showing what are the signs of autism in infancy. So there are some features which can be seen as early as 6 months, 1 year of age also. In 6 months, a small baby, when you call them or try to make a eye contact with them, they should look at your face. If that visual tracking and eye contact is limited, by 12 months of age, if the child don't have any eye contact, don't respond to the name of the name call, and some waving tata bye bye should start, or some gesture communication like some communication, then some imitation should be there by 1 year of age. If that things are lacking, and when the child is too quiet, he is not making sound. When you try to sing, try to talk to the child should engage in a meaningful way. He should make a eye contact, respond to your smiling, respond to your thing. If that child is not doing very quiet, you are trying to engage but not getting engaged, or a too irritable child. So these are some of the red flags that is seen by 12 months of age. Now by 18 months, generally nowadays with more awareness, most of the children we are diagnosing by 18 months, 2 years of age. So what to look at 18 months of age? I will say there is no meaningful word. The child should start at least few words with meaning by 18 months of age. Few words with meanings means he will tell Papa, Papa, Mummy, ball. Some words or some communication should be there. They should, at this age, the child should follow some simple command. Give this thing, take this, give it to me, give it to Papa. So something he should understand and follow. And there is no eye contact or social smile. A child, sometimes parent tell me the child interacts with us, but at 18 months of age, when you take out outside, some neighbor is there or some person known is there, he gives a smile to the child should smile back by that age. If he's not doing or not giving eye contact, not engaging with the person, then it's a thing, maybe thing to worry. Then there is no pretend play. So what is pretend play? Pretend play, we all children do pretend play. Pretend play means they assume something. They will take a block and put it to the ear and say hello with that. They will take a card with a cardboard pack and run it or try to pull it as a vehicle or do something like that. Try to feed the doll, play some pretend play. So these are the examples of pretend play. Pretend play is a mature version of play, and that should come by around 18 months, 2 years of age. So if the child don't have a pretend play, then at around 2 years, so 18 months, I will say the eye contact should be good. When you are talking or engaging with a child, you or parent or somebody known, a neighbor or a relative comes and try to engage with the child should engage with them. So if it's not there, so it may be a red flag. Then by 2 years of age, there is no two-word phrases. At 2 years, the child should say two-word phrases may give me, I want to go, or take me, or something like that. It should come by around 2 years of age. So any age, any loss of words or social skills is again an important thing. Then many children doing this repetitive movement like hand clapping, toe walking, spinning. If you are seeing it's excessive and what is expected for that age, if it is more, then it's a thing of concern. So, and there is extreme resistance to change. The child is very fussy, very difficult. If you want, some children are very rigid about their dresses, the places they sleep, the route they take. So, if these things are there, then it's definitely a sign of red flag or a sign of problem. Along with that, poor eye contact and limited eye contact. Many children with autism at this age give eye contact, but they don't sustain. At 2 years of age, you are expected to sustain some eye contact. When you are trying to talk to the child, momentarily he will look at into your eyes, but then he will start looking here and there, not that sustain. You are trying to tell a story or sing a song to the child. He looks at your eyes for some time, then he looks here and there and don't follow your face, what you are trying to say next. So they don't engage in that communication. So that's sometimes is a sign of concern, maybe. So then again, poor joint attention. Joint attention means joint attention means when I'm looking, suppose I'm sitting and I'm looking somewhere, the child should come and look what I am seeing. So that is joint attention. If you ask him to look at the sky, just you look at the sky. The child should look at the sky along with you. So then this is one, and this pointing is a very important sign. Pointing is a very good important aspect of non-verbal communication. Pointing is what pointing. Mature pointing is declarative. Declarative means when you ask me, Baba, show me the light. I will show the light, then I look at the person who asked me to show it. And I tell that, look, I am showing. So this is declarative pointing. This is the mature pointing. So in many children of autism, they don't develop this declarative or mature pointing. Rather, when they need, they mostly do hand leading. Hand leading means most of the time you see the child will, if you ask him what, child will cry. If you ask him, what do you want? He will not point at something very clearly. Rather than he will catch your hand and take it to the place where the thing is there, then make some crying or make something, then you have to understand he wants this thing or that thing. So rather than clearly pointing, so sometimes this mature pointing, this is lacking in children of autism. So if you see these things, so these are all the some of the red flag signs that is seen in early infancy to first 2 to 3 years of life, and this is an important aspect. And if the child has this symptom, then it's a thing of concern. I don't think this symptom as any one symptom can make a diagnosis of autism. According to DSM-5 criteria, that is the main criteria that we use to make a diagnosis of autism, has a multiple factor. There should be some features of communication deficit, there should be some feature of social deficit, there should be some features of restrictive repetitive, either motor or vocal or interest, then there can be sensory issues. If all the symptoms are present in a definite present, then only we can make a diagnosis of autism. So so this is how many. But if the red flags are there, so definitely there is a thing of concern, and it's the time you should visit to a professional to get a evaluation done whether the child has autism or not. One, again, diagnosis is important, but it's not the heart of the whole thing. It's just a part of the thing. So the golden rule in developmental thing is that we don't need a diagnosis to start intervention. So whether this is autism or social communication disorder or not also, if there is a delay, it needs to be addressed. That's the crux of the thing. So if there is a delay, we have to do something about it. We can't just sit and say कि तब ठीक हो जाएगा. We can't sit and say कि everything will be fine in the future. So rather than wait and watch, do and watch is the better approach in developmental pediatrics. So not worrying about, even if you see something, some symptoms that are worried, and parent always, it's important. If you feel if a parent is feeling that something is not right, then it's absolutely right thing, and you should go to the professional, a trained developmental pediatrician or a pediatric neurologist or a pediatrician who is good in development. So you meet them, get a evaluation done. There are a lot of tools are available for like screening. M-chart we use. It's a very simple tool. This is a parent field form. The doctor will give you a form. He'll ask you to tick. There are 20 questions in it. If three or more than things are positive, then we say that there is a risk of autism. The low risk, medium risk, and high risk we quantify along with that chart. And if the medium risk or high risk of autism is there, then we ask the parents or ask the family to go for therapy and all those things. So This is a very simple chart and good thing for assessment. But the point is that if there is a symptom and you are worried about it, better to get evaluated. Autism or not, if there is a delay, it needs to be addressed in most of the cases. So this is one aspect of this thing. So as I have already told, all speech delay are not autism. So that's what how we say. Uh, so along with that, there are autism has three core areas. There is a delay in social connection. There is a delay in communication, both verbal and non-verbal, and there is behavior and sensory processing issues in autism. So speech delay can be just a tip of the iceberg. There are multiple problems may be there in the child. So an expert can evaluate and tell what to be done. So now when to worry. So this part is covered most likely. So we'll take any questions later. So this part is that we have covered when to worry. Then how to act, when to act, and what to do next. So diagnosis is the first thing, or a worry, or there is a problem. So this is the first step. So when you identify a problem, then what to do about it. So we'll say when there are these multiple red flags are there, when there is a regression. So regression is always a thing to worry, I will say. So if there are autism generally present in two ways. One is classical thing which we say there is a delay from the beginning, and there is a delay from the beginning. So we have seen the symptoms early and there is a delay. And one way to look at it, regression. There are 20 to 30% children have some regression. But again, there is to differentiate. This child is not at par with the peers at around 18 months or 2 years of age. There are some speech is there, some communication skill is there, then it goes down. So this is common in autism, and it's not different. There is some organic or some other problem may or may not be there. So whenever you say there are multiple red flags, there are regression, and you feel that there is something off, then you should act. So as I have already told, act means first we'll do a developmental screening by MCHART and also other areas of development, whether only speech or only communication is affected or multiple domains are affected. So that's the first step to start. Then, if required, we'll go for a diagnostic assessment. There are charts like Indian charts like INCLAIN, Indian Scale of Autism, ISA. There are CARS, ADOS. There are multiple tools are available for making a assessment for autism spectrum disorder that will help you to it. Then if there is symptom or there is delay, one can go for therapy like speech therapy, occupational therapy, behavioral therapy. Then parent training can be done. So I will say don't wait much for getting a diagnosis. If there is a delay, we should go for intervention, and interventions are like this speech therapy, occupational therapy. Occupational therapy, many children, around 70 60 70% of children with ASD has some sensory issues. So when you go to a occupational therapist, can do a sensory profile of the child to look at this deficit or hypo or hyper to some of the inputs, so they can plan a therapy accordingly. Then when there is a behavioral, lot of children with autism has behavioral issues. Behavioral issues mean there are negative behaviors are there. They are very agitated sometimes, temper tantrums are there, repeated meltdowns are there. So sometimes this occupational and behavioral therapy will help in this scenario. So when we look at general population, there are a lot of myths about autism. We have always heard our parents come to us and ask about different myths associated with autism, like vaccine cause autism. So there were papers earlier which suggested this MMR vaccine, but a lot of studies have come which is completely saying this is not true, and vaccine don't cause autism. So any child with or without autism, vaccination should continue according to the developmental schedule or whatever IEP schedule or government schedule. So one should stick to the developmental program and develop what should be done. Second general myth is that bad parenting can cause autism. As I have already highlighted this point, parents should not blame themselves they should, about due to neglect or due to the lack of much attention or more screen watching caused autism. So this is not true, it can have a, as I told, this can affect a little bit on severity. Many parents say कि बहुत बच्चा बहुत मोबाइल देख लिया इसलिए हो गया. Definitely, screen is not good. IFP recommend zero screen time for children before 2 years of age, and just maybe 1 hour between 2 to 5 years of age. So screen should be as less as possible, because again it limits the communication. If the child spends a lot of time on screen, he does not communicate or does not interact with peer, parent, family member, so that can affect the communication skill, but itself can't cause autism. And secondly, I personally feel that when a child has autism spectrum disorder, they have the difficulty with communicating with the parent, engaging with the parent and peers. Therefore, screen is a very good form of engagement from them. And they are visual seekers. So a lot of that movement, that cartoon, that excites them a lot. Therefore, they watch screen more and more in a fixating way rather than a child who don't have autism spectrum disorder. So this is one thing, and so most of the studies have now shown that autism may have some strong genetic basis, though a polygenic condition. That means that not one single gene can be identified. There are multiple genes or interaction of the gene with epigenetic factor may be the cause of autism spectrum disorder. Uh, but it has some genetic basis along with environmental influence. And next one thing is that is the child going to outgrow autism completely? Well, that's not completely true, because some child with maybe very mild symptom with proper intervention may outgrow the diagnosis, but most of the children have some symptom. But over a period of time, if you start early intervention, proper intervention, evidence-based intervention, then children can improve significantly over a period of time. So many studies and many things have proved beyond doubt that early intervention is a very important aspect of autism. Therefore, you should aware of the early signs and early evaluation, and starting the intervention early can have a long-term impact. So basically, autism is a neurodevelopmental condition, wide spectrum. Many children who have milder end of the spectrum with intervention do very well, and early support changes the outcome. Therefore, seeking support early is the key. Now, what parents can do at home also, apart from doing this therapies, because sometimes we have seen the parents are coming from far away places. There are therapy facilities are not available at many places. So what can parent do then? So maybe some few practical tips will be that limit the screen time, or less than 2 year child, zero screen time. Talk, narrate, sing, read to the child regularly. Try to engage with him with meaningful conversation. Then maybe by use of reinforcement also, you, if he's not responding to name call, sit in front of the child, give a loud call. When he looks at your eyes, give a smile to him, and again call him. Now you try to engage him for a longer period of time. Use some reinforcer for this thing also. If he looks at the eye and sustain for maybe 2 seconds or 3 seconds, then give him a cookie or something what he or she likes. Then encourage him, gradually try to increase this duration, and gradually you will see that even without reinforcement, a time will come. Gradually, the eye contact with input, the name calling, looking at you with the name calling will be high. So gradually, this will improve over a period of time. So less activities that you can do at home also. Then follow the child. Then always try to engage with the child as much as possible. Follow the child's interest. Many children with autism are good at painting. Many are good at dancing, playing. Some are good at math. So whatever the child is good at, you can encourage him to do. Engage more in this process. So that will be good for him. Then definitely reduce the passive screen time. Don't human engagement is much better than watching screen for longer period of time. So that can be limited as less as possible. Then engage with turn taking games like hide and seek. Hide and seek means you will hide sometime and ask the child to find you, then encourage him to him or her to hide, then you will find him. So he will learn this is a turn taking game. So one has to hide, then one has to find him. So this improve their social behavior. Then I always tell to the parent that social skill cannot be learned at therapy. It has to be done at the social environment only. Suppose a child, if you take a child to a restaurant 10 times only, he or she will learn how the etiquettes of a restaurant, how to sit there peacefully. If I sit peacefully, my cookies will come, or my French fries will, or my food will come. He learns, if you tell them, if you move here and there, will cancel the order, or this will, if you sit for 2 minutes, I will order this. So gradually the child will learn. If you take him or her to a birthday party for many times, then gradually he will learn what to be done in the birthday party, how to do it. If you say if everything fine, then only I will take it, then it's very difficult. Unless until the child goes to the social environment, learn that what to be done there, gradually it will become better with a lot of patience, lot of time. So that's one engage very important. Then use gestures and word together. Many times children are don't understand only gesture, they can't follow your words or can't understand instruction many times in children. So and couple the gestures with the words, so that will increase the learning. So many things you can do at home that can help a positive impact on the child, and that can lead to improvement of the child. So, so basically now the concept of neurodivergence has come. Neurodivergence says that every person is different. So we are all different. Nobody is same. We have all our strengths and weaknesses. Some children are good at studies, some are good at playing, some are succeeded in studies, some are succeeded in other fields. So everybody is different. Some sleep early, some sleep late. So these are all things. So everybody is different, and no two persons are same. So okay. So I will say ki so the neurodivergence concept is that the autistic children are also little different, and we need to understand them. So so the aim should not is to fix them. It's not a disorder, it's not a disease that we are going to fix it. Rather than it's the aim is that we can make some changes in our environment and try to understand their need and their ways of communication. And definitely with therapy, we'll try and make the things as good as you know, uh, as good as it gets, I will say. We'll try therapy, we'll try all the effort, but we have to understand that it's a condition, and it will be there. There will be social issues even if with therapy and all this. So much and much social exposure will help the child to better do socially better. So these are some of the important things at autism, I will say. And regarding medication part, many parents always ask us about medication. So there are there are no medication that has sufficient evidence that will significantly improve the core symptoms of autism, but there are medication for comorbidities like hyperactivity, aggressive behavior. Then when the child is too aggressive, self-injurious behavior is there, then hitting others, so very difficult to control. So there are medication like Risperidone, aripiprazole that has been approved by FDA. So that things can be used, and there are a lot of supplements that come which use is also there are some evidence that can help in children with autism spectrum disorder. But the basic first line of thing is intervention like therapies and all those things will be helpful in children of autism. So this is a nutshell about autism spectrum disorder, and we'll
So
take
we
up
have a
questions.
question, I think. Yes, so we have a
Yeah,
question
yeah.
in the chat only by
Okay.
Mr. Mahesh Rao. My nephew was born with autism. He is now 6 years. We do all
Mm-hmm.
that you are saying, but yet sometime when a social gathering, his thoughts and acts over a limit. I feel upset for my kiddo, and my sister too got him in painting like me, but now he is too much in it, and where we are, we have to take his drawing books. What is it where we put a checker on it?
Can read my nephew born, he is now 6 years with okay. See, as I have already told ki, discussed na, ki there will be sometimes some issues. So you can't, it's very difficult to say ki whenever you take him to a gathering, maybe it's a overwhelming situation for him. So maybe this can be due to sensory issues. So whenever there is a lot of sensory issues and let's say environment full of noise, full of people, then he may not feel good there. So there can be have a meltdown or a something like that. If it is mostly due to sound, then you can use some noise cancellation headphone where taking to a social gathering or where he finds it difficult for him to engage in that very noisy environment. So if it is there, otherwise. You can deal with that or talk to him before taking to that place. Okay, this will be like this, lot of people will be there will be sound, we have to do like this, we have to behave to like this, you have to sit here, then keep him reminding a little bit. So if you prepare him, take him, and if sensory issues are there, if they are addressed, then he can be better. But again, I will say ki even if with all these things also, sometimes children do find difficult, do have meltdown, and that has to be taken care at their space. And secondly, if you're getting too much into painting, then you can find something other activities also to engage when limiting the if anything is too much is not good, so that we can do maybe.
Picking up the same point, what I would like to ask is like, since he's written that they take away the books, so like forcefully taking away the books, will it be good for the
No, no,
child?
no. It's
Or
not about forcefully taking away thing, that you have to make him understand and engage with other things also. It's not like well, sometimes you have to limit the exposure also. That's also okay, but not forcefully. Definitely talking to him कि वे मतलब दिस टाइम इतना हो गया और नहीं करते हैं अभी, अभी चलो घूमने चलते हैं, लेट्स गो फॉर ए वॉक एंड व्हेन वी कम बैक, सो और यू कैन मेक ए टाइमिंग फॉर ड्राइंग, मेक हिम अंडरस्टैंड दैट मॉर्निंग 1 hour he will get a drawing time and evening 1 hour he will get, or half an hour he will get a drawing time. But you need to engage the child in other activities so that he will be other activities that of his interest also, or take a walk in the evening, don't give instead of drawing. So all these things can be one behavior can be replaced by some other behaviors, so that can be done maybe.
are there any other questions? So another thing we have heard about like autistic children is repetitive behavior. But I think all children at a certain age do a lot of repetitive behavior. So like, how do you distinguish?
Yeah. So the thing is that now anything in excess for age is always a problem. So a child of 2 years of age doing some running here and there is fine. But the same child, if it continues to do at 4 years, 5 years, 6 years of age, then it is not fine. So we have to think whether it's somebody there is without any apparent reason the child is hand clapping. If you leave him, he is doing spinning always, or he is very fascinated with spinning object, lining everything, stuffing every books. Whenever he sees 5 books or 10 books, in irrespective of the place or irrespective of the situation, will start putting over and over. It's not expected. At home, the child is doing. At the child comes in the home, the child is doing the same thing. Uh, he comes to my OPD and he does the same thing, or he goes to a friend's house and does the same thing, then it's not expected. So that's why I'll say ki if it is excessive and it is inappropriate for the environment and age, then it's a problem.
So you mentioned another thing is routine is very important. So like routine as in it's like those military routines that they need to get that feeling of confidence, or it can be like get up in the morning, eat breakfast or something, or it has to be time based because I have seen a lot of autistic children, they have the time, it's important for them.
Yeah, they are routines, they are very strict to their routine. Many children get very upset if their routine is not followed. So, so many children stick to that routine. They have that fixation for that. So I've seen children, they have brush the teeth first, then at this time, then sit there, sit at a specific place in the dining table, eat a specific type of food they need, they want. So these are some of the strict adherence to routine. You need to increase flexibility. We need to talk to them, try to find a flexibility.
Mr. Mahesh also agrees.
हाँ
Yes,
हाँ
sir.
ठीक है ठीक है हाँ तो
So I think a lot of parents would want to know when a child with autism throws tantrums, and especially in a social gathering, how should they handle? At home, it's easier, but in a social gathering or a social place, how should they handle?
see, there are two things here. One is tantrum and one is meltdown. ठीक है ना? Tantrum is basically a negative behavior. So a tantrum happens generally when the child wants something. There are two, three main reasons for negative behavior in children or tantrums maybe. One is that he's some tangible. He wants to buy a toy in the mall. You didn't give him a toy. You didn't give him a what toy. You didn't buy him a toy. Their child throws a tantrum. He lies down on the floor, cries loudly. So this a tantrum. Then second is due to uh, escape. You want the child to do a homework or do something. He don't want to do it. He will uh, then so these are some of the common reasons for tantrum. So tantrum you have to deal with as we deal with negative behavior. Don't give in to the tantrum. We give in to the negative behavior. Suppose a child wants a toy and you buy him he cries loudly in the mall and you try to escape a scene and buy him the toy. So next time also he knows ki when you are taking him to a mall or most likely that subconscious level, he feels ki if I cry, I'm going to get this toy again, or going to get what I want, or going to escape something I want to do. So, this thing, many children do negative behavior for attention also. You are doing watching TV, you are not giving attention to the child. You will try to do something to gain your attention. But the basic is that ki deal with what is right or wrong, you have to deal it in that way. Don't give in to the tantrums or give in to the negative behavior. Then gradually meltdown is a different thing. Many autistic children have severe meltdown because the environment is hostile, because they cannot adjust to the environment. You take the child to a party, there is a lot of high music is going on, there are a lot of people standing, lot of uh, people are around. So this is a meltdown. Meltdown, you can't do anything. You try to take him from that environment, try to calm the child, try to be with him. Gradually, he will calm down. Gradually, will take some time, but gradually, you can't just stop him at that time with scolding him or forcing him to stop. Stop. He's not going to stop. But this is maybe most likely due to some sensory issues or something. So this is difficult to control. Give him some time, take him away from the place, wait for some time, sit in the car or sit outside the room. Gradually the child will settle. So we have to see what is, whether it's a tantrum or it's a meltdown, and deal it accordingly.
So we have another question which came in from YouTube. uh,
Mm-hmm.
स्टमक पेन की शिकायत करती है, पीडियाट्रिशियन ने इन्फेक्शन की मेडिसिन दी थी, एंटीबायोटिक 7 डेज तक दिए, पर उसके बाद अब भी पेन बोलती है, क्या करना चाहिए? We are
So,
assuming that the child has autism, I think.
no, I
Yeah.
understand. So it's difficult to say without seeing the child. So many children can be some functional, but it's very difficult to say whether child has some stomach problem or something else. Whenever there is a physical symptom, well, many times this physical symptom can be a feature of functional problem, or can be there, but still one needs to more meticulously look at by pediatrician why there is a pain, whether there is some gastritis, whether or something else is going on, and treat it accordingly. Very difficult to say on a what's going on without us.
Sir, our next question is from Mr. Abu Bakar. He said, I
Mhm.
wanted to know the difference between sensory processing difficulties and autism spectrum disorder. And is there any relationship with primitive reflexes in children with autism spectrum disorder if some of the reflexes are retained after the initial year of birth?
So there are two parts to this question. Uh, One is that autism spectrum disorder and sensory processing disorder. So as you see this initially there are all these terms were used, but now with DSM-5 in 2013, well, the says you use the term autism spectrum disorder rather than other terms like this. And coming to sensory processing difficulties or sensory processing disorder can be a part of the autism spectrum disorder. It can be there. So many children with autism has sensory processing issue, but these two are not same because autism spectrum disorder can have without sensory processing issues also. But what we have seen ki most of the children with autism spectrum disorder has some form of may have sensory issues like hypo or hyper, like your problem with proprioception and problem with maybe vestibular stimulation, touch. Many children are very here to hyper to touch, hypo to touch also. They don't feel pain or don't feel pain as much. Many time parent के इतना जोर से लग गया लेकिन रोया नहीं, कट गया थोड़ा टाइम रोया फिर चुप हो गया. So many children are hyper to sound also. They are specific sound like going to a temple and this ghanti at the temple, pressure cooker sound, whistle of the pressure cooker. Then all these things are sometimes they are very difficult. They close their ears. Some children are very afraid to go and sit in a swing, so they have their vestibular issues. Some are very resistant to go on a merry-go-round or a spinning thing. So these are all sensory issues are there. This can be a part of the autism spectrum disorder. And if you see the DSM-5 criteria also, the second part has this A2 part has sensory issues, 4 or 5 questions on sensory issues in this also. So it's a part of the autism spectrum disorder, but ASD can be diagnosed without sensory issues also when there is a difficulty in communication, socialization, along with that, um, uh, along with this sensory and repetitive behavior like motor behavior like hand clapping or toe walking, all those things, along with vocal like echolalia, delayed or immediate echolalia, then very fixed patterns like using one type of toy, one type of dress, sitting at one place for eating like that. So even if without sensory issues, if all the other criteria are there, we can make a diagnosis of uh, autism spectrum disorder. And second part is primitive reflexes. As you know, primitive reflexes are these reflexes that usually disappear, like Morose reflex, atonic neck reflex, this asymmetric tonic neck reflex, then symmetric tonic left reflex, tonic labyrinthine reflex. So these are can be so many children in ASD, some primitive reflex may be retained or may be poorly integrated. That may show a immature natural system or a altered sensory motor processing in this thing. So sometimes Moro, sometimes ATNR can be retained, but appear clinically maybe for that the child may be sometimes clumsy, poor handwriting can be there. There can be sensory sensitivity sometimes, can be difficulty in sitting still, all those, yeah. So primitive reflex does not mean that there is brain damage or they do not replace the autism, but may have a point of view of sensory process, sensory integration, or point of view of occupational therapy, they can have importance also.
Are there any other questions?
I think we're done.
Yes, sir, I think we're done. Thank you, everyone, and thank you, Dr. Panigrahi, for your insights and your helpful guides for parents, which can be helpful, I hope. And thank you, everyone, for attending the meeting. Have a very nice day.
Thank you so much, sir. Thank you so much.
Thank you, sir. Thank you so much. Very, very nice interacting with you all. Thank you.
Thank you so much.